To India now, where the COVID-19 caseload continues to rise at a record pace. On Friday alone, the country reported over 400,000 new infections and nearly 4,000 deaths. Actual numbers are feared to be much higher still. International aid is starting to trickle in, but for many in a country ravaged by the pandemic, that helping hand comes too late.
This is the bitter reality of India's COVID emergency. Nearly 250,000 lives lost. As the bodies mount, the crematoria struggle to cope. And there's no end in sight to this crisis. Hospitals too are buckling under the pressure. There's a lack of beds and a lack of staff. But the one crucial thing that has made this second wave different and more devastating than last year's emergency is a lack of oxygen.
This time main problem is not the numbers but the complications. The patient in last year only 10 to 20% patient required oxygen. Around only 5% required ICU admissions. But this time more than 50%, around 60% are requiring oxygen.
These people could have a greater chance of surviving the crisis. They're in the queue to be vaccinated. But the rollout has been slow and jabs are in short supply. International aid has begun pouring into India. Supplies of medical equipment are now arriving from all over, as other countries wake up to the scale of the tragedy and the threat it could pose to their own populations. But the aid cannot arrive quick enough to slow down the dying. Families are helpless as their loved ones succumb to what researchers say is a far more infectious strain of the virus. But there's anger too, with some asking why the government has decided to allow election rallies and other large events. Call it the system or government or whatever, was it necessary to conduct elections right now? For this family and countless others, that question comes too late.
Well, we can bring in DW's Delhi Bureau Chief Amrita Cheema now. Amrita, what's the situation today?
Well, Anthony, to some extent, the numbers speak for themselves. Another huge record rise in new infections. Now, obviously, the virus is on the rampage across the country. In some areas, though, there's some signs of improvement. Delhi, for example, saw a slight drop in numbers in the past 24 hours. And also Mumbai, there seem to be signs of improvement there. So these two cities were the hardest hit. But the virus has spiked in other parts of the country, in states in the south and in the east. And we heard in your report about election rallies. In fact, some of the states where elections were held recently have seen a huge surge. But most worrying at the moment is actually news coming out of rural areas. For example, in the northern state of Uttar Pradesh, people say the situation there is dire and infections are really going up.
Amrita, we hear that international aid is arriving. Is it yet making a difference on the ground, though?
If it's reaching the people who need it, yes, it's making a difference. Germany, for example, sent a huge consignment yesterday and today, and that is a mobile oxygen generation plant. Now, this is going to be assembled and become operational in the next few days. A team has come along from the Bundeswehr, the medical team, which will set up this oxygen plant, as well as train local people here to use it. And the capacity it has, Anthony, is it can generate 400,000 litres of oxygen a day. Now, for people who have access to that kind of oxygen in the medical facility where it's being deployed in the outskirts of Delhi, it's a huge gain.
Outside of those particular examples, what's the latest on oxygen supplies across the country? Are there any signs of relief, and is it reaching those who need it?
I think there's still a big oxygen crunch in the country. And if you also think about the scale of this pandemic, the need for oxygen has gone up sevenfold in the last few weeks. So there are cities like Delhi which say they're simply not getting enough. They want 700 metric tons. They have less than half. In the south, Kerala, for example, had an oxygen surplus and now it's struggling. We're hearing stories from Rajasthan or the city of Chennai in southern India where people have died in hospitals when oxygen ran out. And Bangalore or Bangalore is the latest hotspot where we are getting distress calls about how oxygen is in very short supply. Now, the Prime Minister had a meeting with his ministers, and he's hoping that some of these what are systemic problems and some of them what people are calling we need to audit the supplies of oxygen are tackled with.
Delhi Bureau Chief Amrita Chima, many thanks.